My name's Kyle. I'll be your nurse practitioner. What brings you in today?
I'm having chest pains.
And where's your chest pain located?
Right here.
And for how long have you had it?
For the past few days.
And how old are you?
I'm 18.
Now, if you could describe your chest pain for me, how would you describe it? Is it crushing,
It's an
stabbing?
aching.
It's an aching. Now, is there anything that makes it worse? Is it worse when you eat, when you're doing activity?
No.
Is there anything that makes it better? Does it get better with rest? Does it move from this area here to your arm or to your neck or to your back?
No.
Okay. Now, as far as your chest pain is concerned, is it aggravated by breathing?
No.
Have you taken any over-the-counter medications for your chest pain?
No.
Okay. What kind of activity do you engage in at school? Are you in sports?
No.
Have you had any traumatic injury prior to the chest pain taking place?
No.
Were you eating a meal before the chest pain came?
No.
Okay, so now I'd like to ask you some questions about your past medical history. Do you have any history of head injury?
No.
Dizziness?
No.
Lightheadedness?
No.
Problem with your vision?
No.
Any pain in your eyes?
No.
As far as your sense of smell, any changes with your sense of smell?
No.
Runny nose?
No.
Bloody nose?
No.
Any sinus problems?
No.
Have you had any frequent colds?
No.
Have you had any problems with your hearing, ringing in the ear, or aching in the ears?
No.
Any difficulty swallowing or hoarseness?
No.
As far as your lungs are concerned, do you have any problems with asthma or bronchitis?
No.
Any shortness of breath?
No.
Any wheezing?
No.
Any pain with breathing?
No.
Do you have shortness of breath when you're lying down?
No.
Do you have any swelling of your legs or ankles or feet?
No.
Do you have any chest pains other than the issue today? Have you ever had chest pain in the past?
No.
Do you have any tightness in your chest?
No.
Any pressure?
No.
Do you have any heart murmurs?
No.
Do you have any problems with your heart valves?
No.
Is there any other past medical history that I need to know about? Any history of anemia, low blood count?
Low blood
You
count.
do have low blood count. Any history of having pneumonia? I asked you about the asthma and bronchitis already, but no pneumonia.
No.
Any problems with blood clots?
No.
Any varicose veins?
No.
Any problems with your thyroid gland,
No.
gallbladder, liver?
No.
Any problems with peptic ulcer disease?
No.
Any heartburn?
No.
Any problems with digesting food?
No.
Has there been any change in your bowel habits?
No.
How often do you have bowel movements?
Every day.
Okay, you have bowel movements every day. Any diarrhea, constipation,
No.
nausea,
No.
vomiting?
No.
Okay. Any change in appetite?
No.
Do you eat frequent meals each day?
Yes.
Okay. Generally, how would you rate your health? Would you say you're in good health or poor health?
Good health.
Now, on a scale of 1 to 10, the pain that's in your chest, how would you describe it? What number would you give it? With 10 being the highest number and 1 being the lowest number?
8.
Okay. Any recent weight loss or weight gain?
No.
Okay. And any chills, fever, or night sweats?
No.
Okay, now we're going to move on to your family history. When I speak of your family, I'm speaking of your parents, your siblings, and your grandparents. Is there any history of hypertension, diabetes, or cancer in your family?
No.
Now we're going to move on to your social history. Your social and personal history has to do with activities that you engage in on a daily basis. Do you drink alcohol?
No.
Do you smoke cigarettes?
No.
Do you do any recreational drugs such as marijuana, cocaine?
No.
What kind of work do you do?
I'm unemployed.
Okay, and where do you live?
In college dorm.
Okay. And are you engaged in sexual activity?
Yes.
Are you on birth control pills?
No.
When was your last period?
March 5th.
Do you have any history of sexually transmitted diseases or previous pregnancies?
No.
Do you take any prescription medications?
No.
Any over-the-counter or supplements?
No.
Okay. Any food or drug allergies?
No.
Now, do you have any major stressors going on with school?
Final exams, just normal school stuff.
Okay, no history of depression though?
No.
No anxiety?
No.
No thoughts of suicide?
No.
Okay. Now I'm going to begin the physical exam. I'm going to start with taking your blood pressure, then I'm going to listen to your heart, your lungs, and then next I'll have you lie on the bed so I can take a look at your abdomen, listen, and take a feel of any lumps or masses in your abdomen. If any part of the exam causes you any pain or discomfort, please let me know, okay?
Okay.
All right. Make sure I get this tight enough. Okay, 108/62. Let me write that down. And I'll check the other arm. (110/64). Just write that down. Okay, let's just see. I'm going to check your pulses here. All right. Pulses are 2+, equal in strength bilaterally. Capillary refill, brisk, less than 2 seconds. All right. We'll stand over here, that way you can steal. I'm going to take a listen to your heart, okay? All right. Just going to count your heart rate. Heart rate is 68. Now I'm going to have you take some deep breaths, okay? Deep breaths in through your nose, out through your mouth. And then I'm going to have you lean forward and I'm going to listen from back here. Deep breaths in through the nose, out through your mouth. And once more. Lungs clear. No adventitious breath sounds. Heart sounds S1 and S2 heard. No sounds of murmur. I'm going to have you lie down on the bed for the last portion where I'm going to look at your belly, and then I'm also going to take a look at your ankles and check for swelling. There is no swelling in the lower extremities. I'm going to check for the pedal pulses. Pulses are equal in strength bilaterally. Hair is equally distributed. Now I'm going to raise the lower part of your gown and take a look at your belly. Okay. First I am taking a look at the abdomen. I don't see any signs of any hernia. There's minimal striae present. I don't see any signs of any masses or pulsations. The skin color is even in tone. Now I'm going to take a listen with my stethoscope. Bowel sounds present in all 4 quadrants. Now I'm going to listen for an abdominal aneurysm. No signs of abdominal aneurysm. I don't hear any bruit. Okay. Now, I'm going to try to warm my hands up a little bit. I'm going to have to feel on your abdomen, and if there's any tenderness anywhere, just let me know. You don't have any tenderness. All right. Okay, normal tympani heard in the abdomen. Now I'm going to do some light palpation just to make sure there's no abnormal masses or areas of tenderness. None of the organs are enlarged, and there is no pain with light palpation. Okay, that's going to be the end of the physical exam. You can go ahead and get dressed, and I'll be back in to speak with you.